A very good um, afternoon to our beloved lecturer, Madam Mazwin Kamis, and also to my beloved friends. So, by the way, my name is Ilakim Morris, and I'm from DPH Cohort 18, and I'm currently studying at KPJ IC Penang. So, today, the topic that I'd like to share is about Pharmacology 1 individual video presentation. So, the basics of pharmacology. So what are the terms used in the videos? Based from the video is the receptor, antagonist, and the agonist. So the pharmacokinetic drug cycle involves four of them, which are the absorption, distribution, metabolism, and the excretion. So the definition for the term used based from the video given is excretion. So excretion is how the drug is removed from the body as waste. So besides that, I'm going to state an example of the drug, and by choosing one route only. So it is the most efficient and accurate approach to deliver a dose since the drug enters systemic circulation without the delay caused by absorption processes, thus producing a therapeutic effect faster than any route. So based from the learning points from the given video, we have learned about the drug receptors, the agonist, the antagonist, the receptor activity, the drug action, and analyze the side effects from the video. So pharmacokinetics is another something that we look into. For example, the distribution, metabolism, excretion, and absorption. And the special delivery into the bloodstream, the absorption route, absorption time, and absorption factors are all the things that the body does to the drug. So in distribution, it has a drug delivery blood-brain barrier, a blood placental barrier, and a blood testicular barrier. So we examine the breakdown to a less active or inactive state in metabolism, or known as the biotransformation, right? An organ that includes the liver, especially in most medications, and so kidneys and intestines. So additionally, we study the excretion, which is the process of eliminating waste items from the body. So the main organ that works, as well as the saliva, sweat glands, the lungs, and breast, is the kidney. So now we move on to the first one, which is the absorption, based from the video given in the process of pharmacokinetics. Right. So in absorption, so based from the video shows, the term used in the videos are the process of transporting an unmetabolized medication from the point of delivery to the circulatory system of the body. So besides that is the duration of the drug circulation. Lastly is the cost of the route of administration and its side effects. So the definition of each term used in the video. So the time of the drug circulation. So oral administration is the most prevalent method because this medicine travels through the digestive system, which is absorbed by the gut and distributed throughout the body. So the rise in blood concentration takes some time to slow down and show a dip. And note that the circulation system is too slow and takes too long in process. And the intravenous route will not take as long as the oral route, but it will provide the same dose. Nevertheless, the dose will not be metabolized in the intravenous, or known as the IV administration medicine, because it's traveling to the heart, lungs, and back to the heart and to the artery. The system didn't take long. So as a result, the drug concentration quickly increased. So as a continuation, many of them are now providing the medicine which is in the inhaled form. So only the heart and the arterial circulations are affected by the drug. So this indicates that even if the circulatory system is too rapid and the period is too short, at this route of administration, the medication will shoot up very soon. So one example of the drug in which the process involved based on the video is a oral route. Okay, so the process begins with the flow of blood from the gut to the liver via the teleportal system, which is then flows from the liver back to the vein circulation and into the right side of the heart, and then to the pulmonary artery, then to the lungs, and from the lungs to the left side of the heart, which is then finally out into the artery circulation. So the learning points based from the video given is the medication must be administered at the right time, the right dose and route. So either the most effective route or the same dose will result in a high risk of adverse effects, or you know it as side effects. So the administration route has its own part to take, but it follows the artery circulation system in the body. So now we move on to distribution. So based from the terms used in the videos, there are actually 5 types, which are the purpose of distribution, the process of distribution, the 4 compartments that involves the distribution process, the volume of distribution, and last but not least is the factors of distribution. So the definition of the volume of distribution is a hypothetical volume of fluid into which a drug is distributed. So once absorbed into the blood plasma, a drug can be distributed into one of the 3, or maybe all the 3 distinct fluid compartments. So what are the 3 distinct fluid compartments? So they are known as the plasma compartment, which consists of 6% of the body mass, the extracellular fluid, which consists of 20% of the body mass, and also last but not least, the intracellular, which consists the 60% of the body mass. So as an example, when intravenous, or known as IV, is inserted into the blood plasma, the drug associates by binding molecules with the proteins such as the albumin. So while the unbonded drug is then moved to new compartments such as the extracellular fluid, the fat intracellular fluid, and others such as the CSF, the peritoneum, synovial fluid, and the fetus. So this process continues until there is a balance in each compartment. Therefore, an equilibrium constant is achieved. So the learning points based from on the video given is the objective of distribution is to balance the compartment with an unbalanced capacity. So the volume of distribution, or shortly known as VT, is a pharmacokinetic parameter which representing an individual drug's propensity to either remain in the plasma or redistribute to other tissue compartments. So by definition, VD is a proportionally constant that relates to the total amount of drug in the body to the blood plasma concentration of the drug at a given time. So the balance of each compartment is represented by the number at the back or front of the equilibrium constant. So now we move on to the metabolism, right? So the terms used in the videos are the enzyme in the liver, such as the CYP and the UGT, and also the metabolism processes which involves in the metabolism itself, which are oxidation, hydrolysis, hydroxylation, condensation, and reduction. So in the liver, enzymes such as cytochrome P450, or known as CYP, causes the drug to undergo hydroxylation, which causes the hydrogen that is attached in the group can turn into a hydroxyl group. So through the action of UDP glucuronosultransferase, or known as UGT, causes the attachment of the glucuronic acid group on the drug. So this makes the molecule very water soluble or hydrophilic. So thus the drug can be filtered and can be easily excreted to the kidneys. So on. So as a definition, the pharmacokinetics, or known as metabolism, in the metabolism is the inactivation of medications by the enzyme. So this occurs primarily in the liver, but the other organs that may be involved include the gastrointestinal tract, the lungs, and the kidney. So therefore, if a drug has been metabolized, it has been rendered inactive by the process of metabolism. So as an example, oral tablets such as aspirin undergoes phase 1 metabolism, in which involving CYP enzyme hydrolyzing the aspirin molecule, resulting a product called salicylic acid. So after that, with the help of VDPST enzyme, causes the attachment of glucuronic acid group on the salicylic acid, which then ease the drug to be excreted to the kidneys. So the learning points based on the video given is the enzymic modification of substance on the drug itself is referred to as metabolism. So there are two types of enzymes which is involved in phase 1 and 2, which are the cytochrome P450, which is CYP, and the UDP glucuronidyltransferase, known as the UGT, that aids the drug in order to be filtered and easily excreted to the kidneys. So drugs are metabolized through various reactions, include oxidation, hydrolysis, and hydroxylation. So now we move on to the excretion, right? So excretion, what are the terms to use based on the video given? So firstly is the hepatobiliary system, the route of excretion, one of the majors such as the bile and the renal, and also the renal elimination of drugs, which involves several parts, which includes the glomerular filtration, proximal tubular secretion, distal tubular reabsorption. So lastly would be the clearance. So the definition of clearance, what is clearance? So clearance is the volume of plasma from which the drug is completely removed per unit time. So the amount eliminated is proportional to the concentration of the drug in the blood. So as an example, through nephron, when the drug is reabsorbed, its concentration in the urine decreases and the clearance of the drug will be reduced. But however, if the drug is secreted to the nephron, its concentration will increase. That same goes to the clearance that will increase. So you know the example of the drug that is actively secreted into the nephron is penicillin, which always involves in secretion into the nephron, right? So the learning points based from the video given. So the concentration of the plasma is depend on the amount of dose of the drug given. So therefore, high concentration of plasma causes faster rate of drug to be excreted. So besides that, the first order kinetics and zero order kinetics also are the major points based on the video given. And reabsorption or secretion may happen in the nephron depending on which type of drug, right, is administered. So individuals with kidney disease will have lower glomerular filtration rate, or known as GFR, right, in which will cause a lower clearance. So that is all from me. Thank you.